If you think about it, your doctors probably ask many of the same questions every time you see them. Write down the questions that your doctor usually asks. It's okay to ask your family for help remembering what these questions are. Pick some questions you would like to answer at your next doctor's visit and let your parents know that you would like to be the one to answer these questions. It's okay to write down your notes and take them with you.
She would kind of be the mediator to kind of pull it in and pull me in so that I can actually talk for myself. And my mom was very, very good with that. She was just like, don't ask me, because the doctor would basically bypass me, look at me, and still go ask my mother, hey, so is she eating this? And my mother would be like, well, ask her, she would know the best, and that's how, I got very involved.
Answer questions by myself, and I was always, a part of the clinic visit. I didn't ever feel like I was just being talked about.
It wasn't until I actually had to experience it on my own is when I did learn the skills I did in terms of, writing things down and knowing how to talk to people and, stuff like that. That was my own experience. Because I couldn't, and then I realized I couldn't call mommy and daddy for everything. Every time my stomach was hurting me or every time my head was hurting me or my leg was hurting, my mom and dad wasn't always there to rub it for me. What did I have to do? Try to figure out how to take away the pain for myself, how to stand on my own 2 feet. That's what I needed.
I guess early on I always kind of remember being able to rattle off all the medicines and the dosages I was on, especially when the nurse came in and took down all my vital signs and asked me what meds I was on and whatnot every time. I was always able to relate that. Mom very rarely helped me with that after I could, grasp, dosages and different types of medication.
When answering your doctor's questions, you may not want to admit to skipping your medications or therapies or eating junk food, but it's important to be honest. For example, if you say you're taking all of your pills every day, but your lab tests are not what they should be, then the doctor may increase the amount of medication or change to a different medication, when all you really need to do is get on schedule.
Kids have a hard time. They feel like they have to lie to be perfect, and they don't. They should just be honest, and then they can be perfect.
It's also important to tell the whole story. Maybe you're not taking some of your medications because you don't like the side effects, or because you don't like to be seen going to the school nurse's office. Or maybe you're not getting enough rest because you have too much homework, or it takes you much longer than others to get your work done. Maybe you just want to go out with your friends and have a good time and not pay attention to your doctor's advice. It's important to let your doctor know so that you can work together to find an alternative or a compromise that works. Your doctors will also probably ask about symptoms, when you first felt them, how often and when they occur, and how long they last. Detailed information is helpful. Your parents probably use a notebook that they bring with them to your medical appointments. Now that you're older and probably don't want your parents checking up on you all the time, you might want to take over responsibility for keeping track of this type of information and providing it to your doctors at medical appointments.
I took a notepad and I wrote down questions. I wrote them down, things about my medicine, ways I was feeling as well, because sometimes, a lot of times doctors ask you, what were you feeling? And you'll be like, well, I think I had a headache, or, this is happening. And he's like, okay, well, describe it. What kind of pain was it? What kind of this was it? And you don't know how to describe it. So I've kind of took from what they'll say, on a scale from 1 to 10, what did you rate your pain? So I'll do that. I'll keep notes of myself. And then when I went there, these are the symptoms I'm having.
As you get older, it becomes more and more important to be knowledgeable about your health condition and treatments, and to be prepared to do the talking. For example, you might have to go to an emergency room by yourself, or you may be in the hospital where your parents can't be with you 24 hours a day.
There's a time there was this doctor, well, it was a resident doctor, that was dealing with me, and he wanted to, give me a medicine that I knew I wasn't supposed to take. But because I was young, I guess he didn't think I knew any better. But pretty much it was, in the middle of the night. I was in the hospital, and I told him off. Like, I was just like, who do you think you are? Da 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 da. I just, I told him off. Like, I don't even know how old I was, but I was old enough to know, because my mother always taught me, and my parents always taught me, respect your elders no matter what. So when, it's funny, when the head doctor came in to talk to me, he was like, told him, like, are you crazy? You would have killed her. But at the same time, my mother took me to the side and was like, you don't talk to people like that, no matter what, because you're not getting across to you, because maybe he would have listened to you, but maybe your attitude and the way you were trying to explain what you didn't want to happen to you, he shut down because you were being disrespectful.